It's really important to me that my patients look very natural after surgery. I don't want anyone looking like they've had work done. I don't want anyone looking bizarre or unnatural. So for me, my technique is really important. And the way I approach a facelift is, we're really trying to turn back time a little bit. So whatever steps the tissues of your face and your anatomy went through over the past 5-10 years that led up to you looking like you've aged, we want to take those steps in reverse. So wherever your tissues were 5-10 years ago, we're trying to replace them in that position. A lot of surgeons do a strictly posterior technique where they're just pulling the tissues backwards in a backwards direction because that gives a tight look. It does give you a tight look, but I think it's an overly tight look, and it's not a look that anyone had when they were in their 40s or 30s or whatever age range. It looks tighter, but it looks unnatural. There are other surgeons that only do a vertical vector or only lift upwards, and those tend to look better. However, when we age, we don't just droop down, we age forward and downward. So my technique is a combination of vertical as well as posterior. So it's lifting and recreating the shapes and the contours that you yourself had 10, 15, 20 years ago. And this is one of the reasons that I really encourage patients to bring in a photo from every decade of their life so that it can give me an idea of where you were 10 years ago, where you were 5 years ago, where you were 15 years ago, so we can try to recreate those contours that were native to you.